live, and here she is. Are you with us in the house?
I am here. How are you?
I'm good. I'm trying not to look at like one of my senior citizen family members with the face like from here down. Yes. So it's been a while since we've done We Need to Talk About. And
Yeah.
we need to talk about so much. I don't even know where to begin. But for today, we're going to talk
Yes.
about some of the uh, things that we're going to talk about. So, Maureen, would you like to tell everybody what you want to talk about in general and specifically today? Who you are for those who don't
um,
know you?
well, I want to talk about lots of things. Talking is my favorite, and I think the more we talk about some of the stuff that you and I deal with in our everyday lives as therapists and as physicians, I think that the better off we are, because a lot of our stuff is taboo, and if we don't talk about it, it gets surrounded in stigma. But one of the things that I think would be a good topic is vaginal estrogen. We could talk about that, or topical estrogen in general, because some people ask me, like, can I put it on my face? What about you? Is there anything you want to talk about, or do you want to start with that?
Well, I want to start with that. I just think it's nice to have something specific to talk about, and I think in the bigger picture, we're going to need to talk about a lot of coping things because
Yeah.
things are bad. People are very anxious. It's an unprecedented time. Every time I think people are so anxious, it gets worse and worse. So it's a shit show. But for today, let's deal with something very concrete. So,
Yes.
vaginal estrogen. What do
Yes.
we who needs to know about this? What do we need to know about it? And what do people ask about it?
All right. So, pretty much everybody needs to know about it, women especially. We spend about a third of our lives in menopause, and everybody knows about hot flashes and all of that kind of stuff, but one of the things that happens is the body actually physically changes. The vulva, so the vestibule, which is like 360 degrees around the urethra and the vagina, the urethra itself and the bladder all have estrogen receptors. And so when we go through menopause and there's less estrogen in our system, those tissues physically change. The vagina becomes less elastic and there's less moisture. The urethra can't fight off infection very well, so people have more bladder infections. And the bladder itself has the change creates like more mechanical receptors, which I think is just, I don't know who designed human beings, but that's horrible. So when estrogen levels go down, um, the bladder gets more irritable. So people have to feel like they got to go all the time. This overactive bladder stuff that gets worse in menopause. And topical vaginal estrogen treats all of those things. So it's not just about sex, although I love talking about sex. It prevents the itching and the dryness that a lot of women have that they can't explain. That's not a yeast infection. It helps prevent urinary tract infections, and this is the big one, right? As we age, about 1 in 4 infections in women over age 65 is a bladder infection, and those don't present like they do when you're younger. So you don't get like just burning and stinging. You may just not feel right. You may be a little bit more like, you may feel like you have to go more, or you may leak some more, but you can end up with a fever and like a generalized illness, and we call it urosepsis. And especially in women in nursing homes, it can kill them. So there's bathroom in the middle of the night. If you're looking at stuff besides like how it helps your sex life, because it helps your sex life too.
So here's the question. You're putting the topical. I know that there's a cream. I know that there's a little pill that
Yep.
can be prescribed. Urafem, is it? Uvafem is the pill?
Uvafem, yep, or Vagifem. They're 10 microgram suppositories, and you put them in twice a week. So the medicine kind of comes in a little melty thing that you put in, and it's pretty easy for a lot of people.
So I have a question. You're putting it into your vagina. How the
Yep.
hell does it get to your bladder?
It absorbs through your vagina as a mucous membrane. It's also a self-cleaning oven, but it's a mucous membrane, so it will absorb. And your urethra runs physically like along the upper part of your vagina.
Nice.
And your bladder lays literally over the lower uterine segment, and that kind of physical approximation to your vagina. It's really close.
I
So it
love
will
when you
absorb.
talk all of this OB. GYN stuff. I get to talk to you all the time.
Yeah,
What I want is people to take really good information to get it. It's sometimes I've never had a gynecologist offer me, would you believe it, vaginal estrogen? I'm 68 years old and no one's offered it to me.
I
What
know.
do you make of that?
Well, I make of that there was about 20 years where nobody talked about hormones. And if anybody did bring them up, patients thought that you were going to give them breast cancer because there was a lot of misinformation that came out with a thing called the Women's Health Initiative study back in 2002 and then again in 2004. But that does not include vaginal estrogen. And everything got all lumped together. And then people didn't learn about it, didn't talk about it. And so there's about 20 years of women, and you're in that boat, my friend, that where you just got ignored, which is not good medicine. And so, people should be trying to kind of undo and fix that. And hopefully people have enough knowledge or that was, never should have happened in the first place, especially with vaginal estrogen. It's super low. So there are those suppositories, but there's also there's a cream, which I like a lot. It's 1/100% estradiol. So it's 0.01%. And you put it in the vagina just like the suppositories twice a week. But why I like the cream is because you can rub it on the outside. So that vestibule that goes all the way up to your clitoris, which that under part of the clitoris there is estrogen dependent. So it will help that. So, if you're looking for maintaining like the strength of orgasm or the sense of feeling like building to an orgasm, it's important for that because estrogenized tissue has good blood flow and you need arousal for orgasm for the most part. So you will help that tissue. It'll also help things be moisturized. It'll make things be less painful. A lot of women in their 50s and 60s avoid sex because it hurts. And if you just estrogenize that tissue, it won't hurt. So that's why I like the outside. You can put a little on the
Yeah.
outside.
So the actual the pill part, the pill ones don't actually have the same flexibility being able to be added to the introitus. And I can tell you as a sex therapist, a lot of women do complain, not even all older women, but that they have discomfort around the entrance to the
Uh-huh.
vagina, that hurts at first when
Yeah.
they have intercourse. So this may be something that could treat that.
Absolutely. I pull up a diagram whenever I'm prescribing it for people and I show them the vestibule, that smooth area, not out to your labia, the little labia or the hair bearing labia, but especially down at 6 o'clock. So, like at the bottom of your vagina, closest to that, you know, the perineum, some people call it the taint, like that area above the rectum, that 6 o'clock area, pretty much no matter what position you're in, is going to bear the brunt of the friction and the pressure. And so I tell women to take the tube of cream, rub a little at 6 o'clock, rub it after sex if it hurts you, rub it 4 times a week if you want to. You don't need a lot, but estrogenizing that tissue where most of the stretch and the friction is going to be is helpful.
So it's very targeted medicine.
Yeah.
So, I've had people talk to me, not that I'm an OBGYN, but they talk about, oh no, I can't take hormones. And when you think about it, to me, now tell me if this makes sense. You know how people might use like a cream, like a not like you don't take if you it's not like
Steroids.
taking steroids. It's
Right.
like if you do a local cream, it's not getting into your blood system. So
Yeah,
this is a
exactly.
localized, targeted medicine.
That is the exact same thing with the vaginal estrogen. It's,
Yeah.
yeah, putting a like hydrocortisone cream on a rash is not going to give you like steroid rage, right? It doesn't get into your bloodstream. The vaginal estrogen does not get into your bloodstream either. In fact, the big fear with estrogen for years, right, was that it's going to give me breast cancer. Well, that is not the case. In fact, there are several huge studies that have come out that show that it doesn't increase the systemic circulating levels of estrogen, and that it's safe for women with breast cancer. You're not going to end up with a recurrence. So you don't have to worry about that with using vaginal estrogen. You're just going to improve the quality of your life, right? Reduce the risk of infections, which can lead to death as you continue to get older. All of those benefits, including like a sex life where it's fun and it doesn't hurt. But it's not going to increase your risk of breast cancer. It's not going to increase your risk of endometrial cancer. It's not going to increase your risk of um, uh, breast cancer recurrence. Like, it's safe to use. And just the word needs to get out because I don't think everybody knows that.
Well, I
Um,
think some doctors don't know because I've had conversations with my clients who have a
mhm,
history of cancers. As the doctor says, I can't have any kind of hormone, so it's
yeah,
like they don't get into it in a nuanced way. And this is also preventative medicine because when you
yeah.
think about it, as we age, and if we're not supplementing our vaginal estrogen, our bladders do get more irritable, and we can be at a higher
Yeah,
risk
some
for
people
bladder
just don't know.
infections.
Uh-huh. Yeah. Some doctors don't know. And I do think that's a shame. I mean, internists, in general, like primary care docs, half of their patients are women. And if most of their patients are, over 50 or, in their 50s or 60s or 70s, because I mean, let's face it, when I was 30, I barely ever saw my primary care doctor. Even in my 40s, I might see my gynecologist. But I think gynecologists, urologists, and primary care doctors should all know that this is safe and beneficial for women. And I think it's time that they stop sticking their head in the sand,
So
and start paying attention.
what would you say to a woman who wants to start this conversation with a gynecologist? How to bring it up?
Well, I mean, you can go in armed with studies, but that's a lot of work for the average patient. Like, I wouldn't want you to have to go look for, the 2018 JAMA article where they basically said that, that whole study that scared everybody, overestimated the risk and didn't even show that there was the benefits, and there definitely were benefits to women having been on estrogen. I would tell them that if you find that your doctor is not listening to you, then you need to either let them know, like, you're not hearing me. Like, I've read about this, I've heard about this, I've seen it on Instagram, I've seen it on TikTok. And they should be prepared to have that conversation. And if they don't know, and I do this all the time. If it's something I don't know, I tell the patient, I will look it up and get back to you, or I will talk to somebody who does. And there's a lot of doctors out there that don't do that. And I mean, it's busy. It's hard to keep up with, 20 some odd patients a day. But they owe you listening and then actually trying to help, because, this is real. Like, this prevents death. And so if they're not hearing you, you either need to kind of tell them, which is hard to do, I'm worried about this and you're not listening to me, or I've read that this is safe and I want to try this. If they don't, then ask them if they can find ways to find doctors who know about at least hormone therapy. um, would be to would be to go to the Menopause Society. It lists all of their certified practitioners, of which I am one of many. There's only about 3,000 or so of us in the US, but we're out there. Or you can look, there's lots of some of the people who are out there talking a lot about menopause right now, like, say, Mary Claire Haver. She has a list of people that other patients have recommended that will listen to things of concerns about menopause. And I would advocate for yourself. I know it's hard. It's not easy to do, especially for older women. I feel like medicine was very different and the world was very different when you grew up. The younger girls they don't seem to have any trouble advocating for themselves. If they heard something and they want to know about it, they ask about it.
Mhm.
But if your doctor can't help you, or they brush you off, then you should find someone who will listen. That's my advice.
Speaking of listening, why don't we do a little call to action before we wind up? Why don't
Let's
we
do
ask
it.
people, because we're going to be putting this out in posts on Instagram.
Yep.
Please send us your questions. You can send them to Dr. Maureen Slattery, any medical, gynecological. She's also a sex educator
Hmm.
and a certified sex counselor. So she
Yes,
can
I
handle
am.
lots of questions. And anything that people want to ask me about, as a sex therapist, relationship specialist, we can go in any direction that we want to.
Hmm.
We can talk about anything that we want to, and we're going to need to talk about a lot of stuff. One last thing.
Yeah.
Should you use soap on on your vulva when you are taking a shower? This is one I've heard a lot of people having conversations. Good,
Yeah.
not good.
Yeah, you already heard me say it once. The vagina is a self-cleaning oven, right? So if you're talking about the outside part, like the vagina, the inside. So do not put anything in there that, was meant to be in there. Toys, fingers, Um, Penises, if you like, those are okay. But you don't want to put soap up there. You don't want to douche. But on the outside facing part, the part that we're talking about, right, where it can get dry and itchy, the part that can hurt when you're sexually active, that part in general, if you're going to wash, it needs to be a very mild soap, and you're just going to need to rinse, rinse, rinse. You could literally just rinse your parts with water.
So
And
water's good, and you don't
water
have
is
to soap
good.
it up. If things
Not at
smell
all.
very badly, see your doctor. It could be a bacterial infection, right?
Yeah, it could be a number of different things. And typically, if it's coming from the vagina, it's usually a shift in the pH, and it can be bacteria or yeast or other things. But the other problem is that sometimes things that smell are actually not the vagina. The groin or skin folds, like if you've got, like, from a C-section, or you've got a little bit of, we all menopausal belly with a little skin fold. Sometimes it's actually yeast, or there are apocrine glands that make funky odor kind of in your
Okay.
backside back there. Those areas you can wash with soap and water and get clean. But like your vulva, be gentle to it. Be
So we've
gentle.
proven that we can talk about anything and everything. So I always love talking with you. I'm excited about getting our We Need to Talk About It going again. We'll be
Yes.
meeting weekly. You and I we will go live. Sometimes we'll let people know we're going live, but we're going to do posts
Yeah.
and make some content. And we're really concerned about right now. We need to remember that pleasure is important. A lot of people are having a really hard time with what's happening. So we
Yep.
can't let ourselves get so hijacked by the stress that we're no longer paying attention to our ability to have pleasure in our body. So
Yeah.
such a pleasure, Maureen. I get you all
It's a
the time
pleasure.
now.
I
Now,
know. I'm
other
so
people get
excited.
you too.
Yes.
Okay. So we'll talk more. We'll come back and we'll post more content for next week as well. So,
Let us know
oh,
what you want to talk about,
yeah,
because we're
send us
both open.
questions.
We'll
Yeah,
answer
send
questions. That's
us
what we're here
questions.
for.
And you can send us any question we can answer it anonymously so that you
Hmm.
don't have to feel embarrassed.
Nope.
And we will grow this as a regular practice. So we need to talk about a lot.
Yep.
Peace out and over. Pleasure.
Bye-bye.
Bye.
Bye-bye.